And move that over here. Okay, is everyone able to see that okay? Yeah, great. So as Linda very kindly introduced, my name's Veronica and I'm an oncology dietitian. Today I'm here to talk to you about living well and eating well after cancer treatment. So the talk is specifically focused, as we mentioned, on for people who have gained weight during treatment. And really what we want to do is look at how you can manage this after treatment. The talk is aimed for people who've really completed their cancer treatment and who aren't experiencing any unintentional weight loss. If you are experiencing either unintentional weight loss or any symptoms that impact on your nutritional intake or your ability to eat, your needs are different. So what I would suggest is speak to your oncology team if you have any concerns regarding unintentional weight loss or kind of symptoms that impact on your ability to eat. So you could speak to your medical oncology team, your surgical oncology team, or your radiation oncology team and see if there's a dietitian available in the hospital. There isn't always outpatient dietetic services in all hospital settings. So if you aren't able to see a dietitian in that setting, speak to your GP and they can refer you to a community dietitian. This is also relevant for people who maybe have tried losing weight and need more one-to-one advice. So speak to your GP and see if there's a possibility of being referred to a community dietitian for weight management support as well, if you feel that's needed. Another option that another route that you could take in terms of seeing a dietitian would be seeing a dietitian privately. So you can look at the Irish Nutrition and Dietetics Institute website. So that's www.indi.ie. That is in your resource pack, so don't worry, that it'll be listed in there. But there's a tab on the INDI website called Find a Dietitian, and that can link you up with private dietitians in your area. So if you are currently undergoing cancer treatment, and if you have gained weight or if you are either overweight or obese, what is recommended during cancer treatment is really aiming for weight stability. So preventing further weight gain if you have experienced it. And really this is all about, while you're on treatment, protecting your muscles. We know that when people lose weight whilst they're on cancer treatment, they tend to lose a higher amount of muscle mass. And really, we want to protect your muscles because your muscles help keep you feeling fit for your treatment. If you lose muscle mass, it can increase kind of side effects from chemotherapy and increase risk of infection and stuff after surgery. So weight stability is really, really key while you're on treatment, okay? And then really in the kind of post-treatment phase, we would look at kind of aiming for weight reduction if weight reduction is needed. So today we're going to look at, we'll look at why people gain weight whilst they're on treatment. We'll look at how to assess body measurements. This also links in with goal setting. So we'll look at goal setting in terms of, understanding your body measurements and kind of lifestyle goals as well, and how really to set them. We'll look at healthy eating, and then we'll look at meal planning and preparation, and how this kind of fits in and how this can help. And then we'll look at other lifestyle factors as well, just to finish off around physical activity and other factors as well. So we know, from you guys, attending this talk today, we know that many people gain weight at diagnosis during treatment and even in the few years after cancer treatment. Weight gain is a common trend that we see in certain forms of cancer, particularly breast cancer and prostate cancer. So with breast cancer, more than 50% of people can gain weight during their treatment. And it's not entirely clear what is the cause of weight gain during treatment. There seems to be a combination of different factors that are involved. So one thing is age, that we know everyone over the age of 40, we slowly start to lose muscle mass and we tend to start gaining fat mass. It's a very slow change, but this is all in relation to kind of sex hormones. So we lose about kind of 1% muscle per year. And with this kind of loss of muscle mass, that can have an impact in terms of your basal metabolic rate. So if your metabolic rate, if you're just sitting, sleeping, and just breathing, so you're doing absolutely nothing at all, You lose less calories when you have less muscle compared to a person with a higher muscle mass, if that makes sense. Muscle uses a lot of energy in itself, so the more you have, the higher your metabolic rate. The natural process of muscle loss can be speeded up by some factors. So cancer itself is a factor that can cause muscle loss, and cancer treatments, as I mentioned, they can cause muscle loss. So people can actually remain the same weight during their cancer treatment, but have this kind of change in muscle mass. And we see it, commonly again in breast and prostate cancer. You can have this kind of shift in kind of body composition, but weight can stay the same, which can impact in terms of your metabolic rate. And also things like, I guess, strength and movement, all of these things will be impacted if you're losing muscle mass. As a woman, you might have experienced early menopause due to treatment or factors associated, and factors associated with menopause are associated with weight gain. So again, we mentioned aging already, loss of muscle, and other lifestyle factors such as reduced physical activity. These seem to be the primary causes of weight gain in women around the time of the menopause. Lean body mass around the time of the menopause, so muscle mass decreases much faster. It's a much more rapid weight loss during the kind of perimenopause phase and for about 2 years after the last menstrual cycle. So then muscle declines again after this stage, but again at that much steadier natural rate that we'd see. This kind of pattern of kind of more rapid weight loss also occurs with hormone therapy that's designed to reduce estrogen, such as tamoxifen or aromatase inhibitors. Studies have also shown, though, in androgen deprivation therapy that fat mass is increased as well, and lean mass can decrease, which can lead to weight gain. Physical activity, as I've mentioned, is another factor in terms of weight gain. We know the majority of people reduce their levels of physical activity around the time of diagnosis and during cancer treatment. This can impact in terms of weight gain, it can reduce energy expenditure, and it can also impact in terms of your body composition. Reduced activity may be due to things like tiredness or side effects related to chemotherapy or radiotherapy. If you've had surgery, you might be asked to not exercise for a period of time, and many people don't necessarily know where to start when it comes to returning to exercise again after a treatment. And for a lot of people, it just isn't a priority at the time if there's a lot of other things happening, and if your routine and your life has changed quite significantly. From the literature, it seems that the majority of people after cancer treatment don't return to kind of pre-diagnosis levels of physical activity, and this in itself can impact in terms of weight gain over time. We know exercise during and after cancer treatment is safe and possible, and it can reduce things like fatigue. It can help maintain muscle mass. But many people want support when doing exercise. So later on, we'll look at a few kind of good links for Ireland in terms of supporting you during and after treatment with exercise. If we look at weight in really simplistic terms, and it is more complicated than this, but if we look at it in very simplistic terms, we look at energy balance. So it's the amount of calories you consume in relation to the amount of calories you expend in terms of your metabolism and physical activity. So to lose weight, individuals must have a negative energy balance where energy expenditure, so your metabolism and physical activity, exceeds your food intake. With weight gain, this can result from a positive energy balance where energy intake exceeds what you're expending through metabolism and physical activity. So we know that even 100 calories extra per day can lead to about 3 kilograms weight gain over the course of a year. So that's the equivalent of, a chocolate digestive or a banana. So it's not actually a huge amount of calories when you think about it. And that's why little things like, smaller things in food choices can actually make a really, really big difference over the course of, 365 days. As I mentioned, food choices play a huge role in it. So people during their treatment often make different food choices to their kind of pre-diagnosis diet. If somebody's feeling maybe low in mood or they're feeling tired, they might choose things like chocolate, sweets, ice cream as a kind of pick-me-up or something that might give them a bit of energy or a bit of a lift. If you're nauseous, some people find eating more regularly can help um, minimize nausea. So they might have more kind of snacks throughout the day to help control that feeling. If you're feeling tired, you might choose things like more energy dense food, takeaways or pre-made food, just because it's easier, and that's all, you know, fine and normal, but these are just reasons why we might notice these changes. Some people with certain types of chemotherapy find that the sensation in their mouth is different when it comes to food. So they crave kind of starchy, more plain food, and things like salads or raw vegetables just don't feel very nice in the mouth. So it's something that they're kind of adverse to during treatment. And then for people, things like stress can play a really big role. Some people, when they're stressed, or, you know, obviously the time of diagnosis during treatment and after treatment can be a very stressful time, and can increase anxiety for people. So some people totally go off food at this point, whereas other people turn to food at this time for kind of comfort. So you know, I guess weight gain has so many different potential causes, and then all of the kind of other things that are kind of non-cancer related are genes, environmental factors, and physiological factors. They all play a role too, you know, that we would see in kind of the general population. I thought it would be good to just look at ways to measure your body weight. So we know being a healthy weight isn't just about how you feel and how you look, but it's also about your overall health as you get older. Carrying excess weight that puts you in a category of being overweight or obese increases your risk of developing certain health conditions such as heart disease, diabetes, and certain forms of cancer, including increased risk of certain forms of cancer, or cancer recurrence in certain forms of cancer. So it can also impact in terms of things like pressure on your joints. So for every 1 pound of weight gained, that can equate to about 4 pounds of pressure on the knees. So this can have an impact in terms of, you know, joint pressure as we get older, but particularly for women around the time of the menopause, when joint pain is an increased kind of symptom of menopause. It might be something that is more noticeable and can impact in terms of things like mobility. Body mass index is a way of checking to see if you're a healthy weight, if you're overweight or obese. So BMI uses height and weight to calculate this. You can use an online BMI calculator if you want. If you look at BMI calculators in Google, you just need to put in your height and weight and it'll calculate it for you. But if you want to work it out on your own, you do need to take your weight in kilograms. So I would take your weight first thing in the morning on an empty stomach, empty bladder, weigh yourself in bare feet. And I think choosing one day a week, a particular day to have if you're weighing yourself, is a really positive thing to do, and first thing in the morning, because that's going to be your truest weight. If you need to take a height, if you don't know what your height is, standing tall and bare feet, looking straight ahead with your heels against the wall, and get, you know, somebody to lower a ruler onto your head and kind of mark that off, and then use a measuring tape to measure it. But what you want is your height in meters and your weight in kilograms. And then to calculate your weight, what you want to do is, or calculate your BMI, you divide your weight by your height, and then the number that you get, you divide it by your height again, and that will be your BMI. So another thing that you can do in terms of, in terms of body mass index, we know it's a really good tool for the general population. So there's certain instances where it can be a little bit skewed. So people who have really, really high muscle mass, so somebody like an international rugby player or a bodybuilder, their BMI will often put them in the overweight or even obese category because they have really, really high muscle mass. But for the general population, it is a really good guide. But as a secondary measure alongside muscle mass, it is really good to also complete a waist circumference. So the best idea to get an idea about whether you're a healthy weight is checking your waistline too. So carrying weight around the middle increases your risk of high blood pressure and diabetes and heart disease. So They're really good measurements to do together rather than just BMI alone, because we also want to see kind of where fat sits on the body. So to measure your waist circumference, really what you're looking for is putting a measuring tape around the waist and finding the midpoint between the top of your hip bone and the bottom of your lower rib. And usually this sits around the belly button for most people. What you want to do is make sure that the tape is fitting tightly around your waist, snugly, but not digging in. And then you want to breathe normally. So I would generally breathe in and then take the measurement when you breathe out. You want to take the measurement as you're breathing out. So there's different categorizations for men and women. They've both been listed here. And this categorization puts you in a healthy category, a substantial risk, and a significant risk. That's the way they kind of divide the categorizations. So I think when it comes to weight loss, if weight loss is if it is a goal for you, being clear about what you want to achieve and setting really well-defined measurable goals is a key to success. One of the most important aspects of successful weight loss is monitoring. So recording your weight and your BMI and lifestyle goals on a weekly basis is a really, really beneficial thing you can do, and recording your waist circumference. So that's the WC on a monthly basis, because you won't see significant change really on a week-to-week basis. We know that regular monitoring allows you to understand where you're at in terms of mood, food, weight, movement, and activity. It helps you understand what your goals are that you have completed and you're working on, and goals that you're currently looking to achieve. So having it written down, I think, in a little diary is a really helpful thing to do. As I mentioned, if weight loss is your goal, then set yourself realistic goals. Changing BMI category can take a really, really long time. But, a more realistic goal can help, a more realistic goal can be achievable. It can, success with it can also boost confidence in your ability to lose weight and to continue to do so. So I think starting with a weight loss goal of between 5 to 10% of your body weight over a 3 to 6 month period is a really good starting point. And aiming for a weight loss of about 1 to 2 pounds per week, so that's 0.5 to 1 kilogram per week. We know that slow, steady weight loss tends to be, from observational research, when we look at 100,000 people who have lost weight, they look for kind of trends of things that help people be successful, and generally steadier, slower weight loss tends to be kept off in the longer term and more sustainable in the longer term. From a clinical perspective, we know weight loss of 5% is considered clinically significant weight loss, and hence it's a really good starter goal. As I mentioned, number one, it's a realistic goal. Number two, it's quite attainable within a kind of set time frame. And three, it also improves your cardiometabolic factors such as cholesterol levels and insulin sensitivity. So if we look at this example here, I've put of somebody whose weight at the start was 95 kilograms, which is about just over 14 and a half stone. Their BMI is in the overweight category, but actually even at 10% weight loss, they're still technically in the overweight category, although they have lost, 10 kilograms, which is a huge weight loss. It's a really, really successful weight loss, and people should be, incredibly proud of that. But I think if you just look at things like BMI categories, you can feel a little bit deflated with this. If we look at this slide, this looks at different health parameters, and I'll go through what these things are now. But the benefit, the clinically significant improvement is seen in the navy here. So with health-related quality of life, we see a clinically significant improvement with 5% weight loss. Hypertension, we see a clinically significant improvement. Cholesterol, same. Triglyceride levels, picture is on the way. Triglycerides, cardiovascular disease, the prevention of type 2 diabetes and the remission of type 2 diabetes is obviously a higher weight percentage. Things like osteoarthritis, obstructive sleep apnea, NAFLD, which is non-alcoholic fatty liver disease, and this is non-alcoholic steatohepatitis, gastroesophageal reflux, and polycystic ovary syndrome. So this is just a list of different kind of clinical conditions where we see a really significant health benefit from 5 to 10% weight loss. And the more, obviously in the lilac here, up to, 10, 15%, the more, the greater improvement in these kind of parameters. So I hope that kind of makes sense to people. But really what I'm trying to say is, even if you're not changing BMI categories, you can do a really significant, you can have really significant health benefits from 5 to 10% weight loss. So this in itself, are really, really significant goals and really, beneficial for you and your health. Try and get this to move on. Now, when it comes to goal setting, it can be helpful to also think about kind of non-scale victories that you're like to achieve. And I think keeping these written down can be very motivating in the longer term. So these might be things like sleeping better, being more active with your children, taking the stairs and not getting breathless, or being in less pain if you have back pain or joint pain. So I would start with kind of 2 to 3 small lifestyle goals and write them down in an action plan for yourself. Try and be really, really clear with the goals and make it clear on how you're going to follow them. So goals should be SMART. So that's specific, measurable, attainable, realistic, and time bound. So if just say one goal might be, I want to eat more vegetables. To make this a SMART goal, you would say, I want to eat more vegetables, and I'm going to do this by having 2 extra portions of vegetables per day. One will be at lunchtime and one will be at dinner time. I'm going to measure it by writing it down in a food diary, for example, and I'm going to start tomorrow. So it might be something that it doesn't suit to start this week, so you might be saying, I'm going to start on Saturday, because really what you want to know is when you're starting it, that you're consciously making a decision to kind of try and incorporate these goals as often as you set within your goals plan. When you're successful with the goals, you can move on to more changes and build on the ones that you've already established. So if you have a goal that you're not able to achieve, it might be that you have to look back and see if you've maybe set the bar too high, or could you remodel it to make it more achievable for you. People that keep track of themselves regularly, as I mentioned, are more successful at losing weight, and they're more successful at keeping it off from the evidence. So we know that people who weigh themselves once a week are more likely to lose weight. But obviously only weigh yourself if you're comfortable with weighing yourself. Some people, it can cause anxiety or distress weighing yourself. And if that is the case, you can use things like your clothes as a guide, or you could measure your waist and hips. These parameters wouldn't be as probably sensitive to weight changes. So you might kind of notice this more on a, monthly or, on a less frequent basis than kind of weight changes. Keeping a food diary can be really, really helpful to make you aware of your eating habits, and it can help support you in choosing small changes, and can help you feel more in control of your diet. So in the diary, I would record things like what you eat, what you drink, what times you have them, who you're with, and how you're feeling. So for example, it might be a cup of tea and a teaspoon of sugar with semi-skim milk and a biscuit at 3 o'clock, feeling tired. So looking back over a diary can help you see how times, places, people, and mood affect your food intake. It can be helpful for goal setting when you start, because it can help you notice kind of trends and triggers. So it is laborious though. So what I would say is doing it maybe 1 to 2 days during the week and 1 day on the weekend, and see how you get on. I think it can be really helpful at the start of lifestyle changes, because it allows you to see those kind of trends in your diet. And you might do it for a number of weeks, and it might, give you a start for setting goals. You might not do it for a while, but then if you are at a stage where your weight kind of plateaus, you might want to go back to it again. So it's something you can kind of come back and forth to. You can also record activity within that, so keep a track of your progress. A good tip when you are completing a food diary is trying to complete it at the same time as your meals, because we know that recall, if you do it at the end of the day, is often poor. So you tend to kind of underreport what you've eaten. Really what we want to avoid is fad diets. They're often extreme, they're overly restrictive, and they can be quite hard to stick to in the long run. Instead, what we want to aim for is a kind of healthier, balanced eating plan. Planning ahead can be really helpful to ensure you have healthy foods to hand and at the right time. And we'll look at this in the kind of meal planning and preparation stage. I had a lady in clinic last week, who I thought it was really interesting. We'd been speaking the month before about, she had really noticed that a trigger for her was the end of her working week, the last day of her work. She found this to be the day when she finished work. She has about a 40-minute drive home, and she would just have kind of a lot of different snacks and make poor kind of snack choices around this time. And it was something that she brought up, which I thought was great in clinic. And so what we worked towards, or what she worked on really, was having snacks prepared for her drive home. And she also brought like a big bottle of water with her to ensure that she was wondering if kind of she was confusing hunger with thirst, or just something really to do in the car on the way home. And what I thought was interesting when we spoke last week is she said that actually just understanding the trigger she found really helpful. So, to her, the feeling was, I want a snack, but actually what that really meant to her was, I've had a really busy day and I'm really tired, and she found that actually really powerful, just understanding it. So physical activity might also be part of your goal planning. If you want to build up towards, 10,000 steps per day, minimize your time spent sitting when working, or building on structured exercise. So this might be, through the Couch to 5K app, or joining a local fitness class. When we look at physical activity, I would look at it in 2 days. So it's looking at minimizing times of inactivity, so time spent sitting, and then looking at actual physical activity. They're both kind of independent ways of looking at physical activity, and both are actually very, very important. So, if you're working in a desk job, could you take phone calls standing up, or could you go to the water cooler, on the floor above, for example, and take the stairs? So just trying to build in little walks throughout the day. Build up slowly to the amount of activity that you do, and try and have it as part of your daily routine. Finding things that you enjoy can make it easier when you get started with these sort of things, and looking at easy ways to fit movement into your day can help. So things like, as I said, standing up when you're on the phone, parking a little bit further away from your destination or on the far end of the car park, taking the stairs, or getting off the bus a stop or two early. Getting support when you need it is hugely important. So it can make a really big difference with goal setting. So, if you are maybe a little bit shy about going to an exercise class on your own, could you ask a partner or a friend to go with you? And make people aware, people that you live with, aware of goals, and perhaps they can help you as well, especially if they do food shopping or food preparation at home. I think making people really aware and clear of what you're trying to achieve at the time can be really helpful in terms of helping you meet your goals. So I just wanted to touch on this today. The World Cancer Research Fund guidance are what we're going to base our dietary discussion around today. What I hope to do is give you practical tips on how to incorporate these recommendations into daily life. So the guidelines are designed from scientific evidence about how to prevent cancer, but they're also aimed at helping to reduce the risk of cancer recurrence. Unfortunately, there isn't any change that can totally reduce your risk, but there are many things you can do for your overall health and to try and reduce the risk of cancer recurrence and long-term health. The diet advised for cancer prevention is the same one aimed at reducing the risk of recurrence. And it's thought that the same mechanisms that promote cancer prevention also promote the prevention of recurrence. The recommendations are kind of presented in a package of these healthy lifestyle choices, and together they make a really, really big impact on a person's likelihood of developing cancer and many other diseases in a lifetime, such as diabetes and cardiovascular disease. So we won't, I guess, go into these in great detail today, but there is a really great resource developed by dietitians in Cork. So it's Breakthrough Cancer Research. It's available on the Breakthrough Cancer Research website, and the The booklet itself elaborates on each of these points, and it gives the evidence base as to why these recommendations are important for cancer survivors. And the resource also has, the main part of the resource is really healthy recipes for people after cancer treatment. So it's a really, really good resource. And all the diet related points, will be covered on the information from the World Cancer Research Fund guidance today. I've put the link for this booklet in the resources. So there's a downloadable, it is downloadable on the Breakthrough Cancer Research website, or the booklets are actually lovely themselves to just have. And you can order them for free on the Breakthrough Cancer Research website, but you just pay for postage, I think is the way they do it. So it's a really good thing to have though. And, actually, if you are, in the hospital anytime soon, you can always ask. I know, just saying the Mater I ordered, there's a lot of these, around. So you can always ask, your clinical specialist nurse if there's any, they should have these kind of around, but they are, as I said, downloadable, or you can order them yourself. So when we look at, healthy eating, what I just wanted to say at the start is, I think it's really good to focus on what you're doing to nourish your body rather than what you have to cut out or what you have to avoid. So I guess what we want to move away from is food being associated with guilt. I think if you are having something like a nice cake or cheese and wine or something that is generally, encouraged to be limited, I think it's much healthier to enjoy it and savor it without feeling any guilt at the time or feeling guilty afterwards. But try and make it a conscious choice. Try and make it part of the 80-20 rule, which we'll look at in a minute, and aim to find kind of balance within your week as a whole. So have it as a conscious choice. Making lifestyle changes in relation to diet isn't always plain sailing, and circumstances throw up a lot of challenges that can send us off track, and that's okay. You will go off track, that is life, it will happen. But use it as a learning opportunity and reflect on what you might do differently and how you might manage it differently next time, and also look at what you're proud of in terms of how you did get back on track, and keep that in the bank for next time. We'll look at kind of portion control just to start with. So a really simple method of portion control is to look at your plate size. Traditionally, standard dinner plates probably 30 years ago were about 10 to 10.5 inches. Over the past 30 years, there's been an increase in the size of your plate. So usually most people now at home would have kind of 12 to, 11 to 12 inch kind of plates, and we eat with our eyes. So by reducing the plate size, we often will obviously put less food on the plate. Portion control is a really important aspect of weight management. I use quite a crude method of portion control, but I think it's really helpful when you're on the move or you're doing things quickly throughout the day. It's a method called rule of hands. It's a very simple way to kind of remember that you're aiming for a kind of palm-sized portion of protein. So that would be things like your eggs, fish, beans, meat, tofu, lentils, etc. You're aiming really for the kind of flat side of your hand, particularly when it comes to meat. When you're looking at carbohydrates then, which would be your portion of things like rice, pasta, potato, bread, cereals, etc., you're aiming for no bigger than your fist. So if we think about if you're portioning kind of spaghetti bolognese at home, or a pasta dish at home, or even a rice dish, most of the time it's much more common for us to have more than one fist size. Some people would have even kind of 2 to 3 fist sizes, within their evening meal. So if you do find that your carbohydrate portion is larger than this, what we want to do is fill up on the vegetables. So with vegetables, you're aiming for kind of 2 open hands, or 50% of your plate. So your lunchtime plate and your dinner time plate should have about 50% veg, or 2 open hands. Fruit and vegetables are obviously very low in calories, very rich in fiber, so they can help keep you fuller for longer, but provide less calories than something like a larger portion of carbohydrates. A good way to think about eating well is to choose the 80-20 approach. This means choosing healthier foods 80% of the time and allowing yourself more flexibility 20% of the time. I would kind of base this on a kind of week as a whole rather than a day. I hope that makes sense. So with that, it's really, I guess, if you are at a birthday party, or if it is somebody's birthday at home, or you're meeting friends for some food, if you wanted to have a dessert, or if you wanted to, have something in the coffee shop, I think it's really making it a conscious choice, enjoying it, and kind of building that into your week. So it's not something that you would have every day, particularly if you're looking at weight reduction at the time. So carbohydrates, we'll just kind of go through different kind of macronutrients now, and just talk through what they are, and how they kind of work in the body. So carbohydrates are things like your pasta, rice, biscuits, potatoes, butternut squash, cakes, and even down to kind of table sugar. There's three different types of carbohydrates. There's sugar, starch, and fiber, if we're kind of breaking them down further. Um, most carbohydrates most carbohydrate foods contain a kind of mixture of these three types. So sugar, starch, and fiber. Sugar is found naturally in some foods like fruit juices, and lactose in milk. And then there's other forms of sugar, such as table sugar, which can be added to food, like or processed foods, particularly such as chocolates, biscuits, soft drinks, and sweets. Starch is made up of many sugar bonds, or sugar units that are kind of bonded together. So these foods come from plants such as wheat and potatoes, and starchy foods provide slower and steady release of energy because they have to be broken down. All of the different bonds have to be broken down, and digested and absorbed. Fiber is found only in plant-based foods, and fiber helps with digestion. It can help lower cholesterol, and it can provide a slower release of energy. So fiber generally takes a lot longer to break down as well into kind of plain sugar that can be absorbed. So good sources of fiber include fruits and veg with the skin on, whole grain breads, whole wheat pasta, beans, lentils, nuts, and seeds. So we know that carbohydrate in the body is used to fuel your muscles for daily activities. So things like, things as basic as breathing, walking, but also things like working out. Any excess sugar or any excess carbohydrates that aren't used for your metabolism, for energy, or any energy expenditure, they're converted to fat in the body, and they're stored in the adipose tissue. So really, when it comes to eating carbohydrates, within your lunch and dinner time meals, I'd really be aiming for a kind of fist-sized portion. And what I'd aim for is really try and eat plenty of what we see in the green column, and try and minimize what we see in the orange column. The reason to kind of promote foods in the green column is that they're really rich in fibers, vitamins, and minerals. The fiber will help you feel fuller for longer. Fiber and these kind of slower release of carbohydrates will also help control your blood sugar levels. Fiber can also help reduce cholesterol levels, and it can reduce your risk of certain forms of cancer, such as colorectal cancer or breast cancer. Minimizing your intake of foods in the orange column is mainly due to the fact that these foods may lead to weight gain, so they tend to be digested more easily. The lower fiber intake may end up with you feeling more hungry sooner. As I mentioned, the sugars are more available, so you might see kind of spikes in your blood sugar levels. And often they have less nutrients than what we see in the kind of green column here, so in whole grains. When we look at fruits and vegetables, sorry, so fruits and vegetables, as I mentioned, are really rich in fiber. They can help keep you feeling fuller for longer. They're really rich in vitamins, minerals, which have cancer preventative benefits. And they're very low in calories, so they're very helpful for weight loss and weight maintenance. So there isn't any particular type of fruit and vegetable that I would recommend, and actually a really good variety is helpful. So I don't know if you've heard the idea of eating the rainbow. So the more colors, really, the better. All of the different colors in fruits and vegetables have their own health preventative qualities. So the red that we see in red peppers or tomatoes is an antioxidant known as lycopene. So this can help protect from certain forms of cancer. The green and cruciferous vegetables like broccoli and cabbage are rich in things like indoles and isothiocyanates. which are phytochemicals that have anti-cancer properties. White and brown vegetables such as onions, from the onion family, have allicin, which have anti-tumor properties. Purple and blue fruits and vegetables get their color from something called anthocyanins, which are really powerful antioxidants and have very strong anti-inflammatory qualities. So they all have different benefits. What we're aiming for is a minimum of 5 portions throughout the day. And really that is really the minimum. So the more the better kind of after this point. The term 5 a day was actually pulled from observational research, where they looked at how many fruits and vegetables provided a health benefit for people. And what they found is when people had 400 grams, which is the equivalent to 5 a day, of fruits and vegetables, they saw an increase in benefit. And then it's really linear after that point. So the more you have, the more benefit in terms of reducing your risk for weight control, for reducing your risk of certain forms of cancer, cardiovascular disease, and diabetes. But in Ireland, there is a significant, about a third of the population don't actually meet the kind of recommendations for 5 a day. So it is something to maybe look at yourself within the diet, especially if you're taking a food diary, and see if you are meeting that, and if there's ways that you could maybe increase it. So what is a portion? Well, as I mentioned, aiming for kind of 2 open hands of veggies on your lunch and dinner time plate. This could be in salads, steamed veg, or lots of different things you can do with it. But I guess a portion itself is 80 grams, or kind of 1 cup canned. And when it comes to juices or smoothies, it's about 150 mils is what's recommended as a portion. So protein comes from things like meat, fish, eggs, beans, tofu, lentils. There's also protein in nuts, seeds, and dairy products as well. Proteins are really important. They're the building block of our muscles. So they're also the most kind of filling element in the diet, and so they can help in terms of appetite regulation. Studies have shown that having a high protein breakfast can reduce your total calorie intake throughout the day by up to 400 calories. So they naturally are quite filling, and they're very helpful to have in each meal throughout the day, because of their kind of control in terms of appetite regulation. But they're also helpful to have in at least 2 to 3 meals per day for our muscle mass. So as I mentioned, there's a lot of potential reasons why people may reduce their muscle mass. Age is one, cancer treatment impacts on muscle mass, reduced physical activity impacts in terms of muscle mass. So feeding your muscles throughout the day seems to be a really beneficial thing, compared to having like one large portion of protein in an evening time meal. So is any particular protein better than another form? Well, we know the World Cancer Research Fund encourages, or they've kind of graded proteins. So they found that fish, beans, pulses, and chicken are very protective to have in the diet. And they're also kind of lean sources, so they're lowering, they'd be lower fat, lower calories. So try and include oily fish in the diet twice a week, things like mackerel, trout, salmon, tinned sardines or fresh sardines, herring, anchovies. Those types of things are all oily fish. Aim to have white fish 1 to 2 times per week as well. Use things like butter beans, kidney beans, lentils, beans on toast as their own meal, or they can be added to, they can also be added into red meat dishes like lasagna. So you could add lentils into lasagna, or into bolognese, and chili con carne, making up bean stews. But these are really helpful for reducing kind of the red meat portion in meals. And then things like having poultry like turkey or chicken, but really aiming to have these meats with the skin off to also help reduce the kind of fat content. What we want to do is try and limit red meat to two portions or less per week. So this includes things like pork, beef, lamb, veal, venison. We know these types of meats are higher in saturated fats, and generally have a kind of higher fat content. And what we want to do is avoid processed meats. So that's your cold cut meats you get in the deli counter, charcuterie, rashers, sausages, pudding, etc. Black and white pudding. So the World Cancer Research Fund, or the World Health Organization, has classified processed meat as a group 1 carcinogen, meaning that they're known to cause or be associated with an increased risk of certain forms of cancer, and that would be cancers like stomach cancer and bowel cancer. So red meat is something that is a really good source of protein. It's a really good source of B vitamins and iron, for example, but it is something that we would limit to 500 grams per week. It seems to be safe in terms of intake of less than 500 grams, but it may cause things like colorectal cancer in higher amounts. So more than 500 grams per week, which is quite a lot. It's, the family pack of mince is about 500 grams. Trying to limit red meat, you might replace, as I mentioned, red meat with beans or lentils and stews and casseroles. You could try making things like fish cakes or chicken burgers rather than beef or pork burgers. To try and limit or avoid processed meats, it's how you kind of swap things up in the diet. So if you like to have a fry on the weekends, for example, maybe replace sausages, rashers, and puddings with things like baked beans, eggs, tomatoes, and mushrooms. So this will reduce the calorie content, but it will also really increase the fiber content. Within things like sandwiches and salads, you can use things like tinned fish, hummus, low-fat cream cheese, roast chicken, roast vegetables, egg mayo in sandwiches. These are all kind of good options for these meal times. Next, we'll look at fats, and fats are a really essential part of a healthy, balanced diet. They are needed in many physiological processes, including the production of hormones and bile acids in the body. However, as a population, we tend to have too much fat. So fat is a very energy-dense compound. So it has more than twice the amount of calories than what we would find in carbohydrates or protein per gram. So if you have 1 gram of fat, the equivalent is 9 calories. If you have 1 gram of protein or carbohydrates, it's 4 calories. So, per gram, it is very energy dense. And for that reason, particularly if you are looking for weight control or weight loss, controlling your fat intake can be a really, really helpful thing for reducing your total calories throughout the day. So I guess looking at this table then, it's really aiming to kind of minimize the foods in the red category and replace them with what we see in the green. So avoiding or limiting kind of things like processed meats and the hard fat on meats, things like pastries, cream, butter, cheese, mayonnaise, aiming for the kind of low fat versions of these things is certainly helpful for reducing total calories throughout the day. Limiting things like cakes and biscuits, gravy, maybe using gravy granules rather than using the meat juices to make gravies, and choosing, if you're having potato salads and coleslaws and things like that, which are much more common around this time, if you're choosing the low fat versions. So other things that I just put in blue are very kind of healthy fats, but again, when we just look at the energy density of these types of foods, we just want to have them in kind of moderate amounts. So things like nut butters, unsalted nuts, avocados, olive oil based breads, and oils such as rapeseed oil and olive oil. They're all really healthy things to have, and are full of unsaturated, mono and polyunsaturated fats, which are a very good thing to have in the diet, but just also kind of controlling the portion of them to help kind of monitor and limit calories. So in terms of alcohol, the advice from the World Cancer Research Fund is to limit alcohol consumption. So there is strong evidence that all drinks containing alcohol can increase your risk of certain forms of cancer. And to reduce your cancer risk, it is advised not to drink alcohol at all. Alcohol itself increases cancer risk in a number of, it's thought to increase cancer risk in a number of different ways. So alcohol is converted to a chemical in our body called acetaldehyde, and that can damage DNA, and it can stop the DNA from repairing properly as well. Alcohol can increase the levels of certain hormones such as estrogen, and particularly in estrogen-dependent cancers, that that is something obviously that you would want to limit. So if you do drink alcohol, and it is a part of our kind of culture and it's part of society. So what I would say is really try and stick to national guidance. So aim for a few alcohol-free days per week. So 2 to 3 days per week where you don't drink alcohol as minimum, and then stick to the national guidance, which is 17 units or less for men and 11 units or less for women. It is also worth, though, when it comes to weight control, thinking about the calories in drinks. So a pint of lager or beer is about 170 calories, and a large glass of wine is about 190 calories. So, if you are looking at weight control, this should be something that is kind of factored in. And then with food diaries, it is helpful if you are recording them to record any drinks that you are having, and that's why it can be helpful to have days that are covered from the weekdays and also the weekends, because we often see that people would maybe have more alcohol on the weekends when people aren't working or family isn't working. So in terms of dietary supplements, I just wanted to touch on this. We know that people who've completed their cancer treatment often take more supplements, and in the kind of belief that there is a wide range of health benefits from taking supplements. Generally, the World Cancer Research Fund advised against taking supplements in terms of reducing your risk of cancer, and instead try and meet your nutritional need from a varied, healthy, balanced diet. We know whole foods provide a lot more than just vitamins and minerals. They provide things like fiber, protein, and phytochemicals that play a really important role in terms of health. When we look at exceptions to this, we know in Ireland that between 20 and 50% of the population are vitamin D deficient in winter, and depending on age, so that the risk of deficiency increases with age. Vitamin D deficiency is also more common after cancer treatment as well, because of its role potentially in inflammation, or its anti-inflammatory kind of properties. So it is commonly seen after things like chemotherapy, if you look at people's vitamin D levels at the start and at the end, that they tend to be lower after treatment. So it is worthwhile to have it checked. If you don't know what your levels are, it can be a helpful thing to know and understand. So there are only kind of small amounts found in the diet naturally. And vitamin D supplementation is recommended for all people in winter months. So if you're under the age of 65, it's recommended from September to May that you take a daily supplement, 15 micrograms. And if you're over the age of 65, you would take that all year round. If you're a person with darker skin ethnicities, you should also take a supplement all year round, even if you're under the age of 65. And the reason for that is that we make vitamin D in the skin. And for people with darker skin colors, the synthesis in the skin isn't as effective. For some people, though, they may be recommended by their medical team to take supplements on certain conditions. So that might be if you have a high risk of osteoporosis, if you've had bowel surgery, you might have reduced absorption of certain nutrients, or in the case of a known deficiency. So follow your medical team for any advice regarding supplementation. But for most of us, if you haven't been advised, we can get it through having, eating the rainbow, getting a good range of your fruits and vegetables, having a good range of whole grains and proteins in your diet. So just in terms of finishing up, I just thought I'd put up some kind of, I guess a summary of the things we discussed, trying to replace some meat in one pot dishes, with things like pulses and beans. If you're eating poultry, try and have skinless meat as an option. And if you are having other meats like red meats, try and choose the leanest cut and trim away any fat before cooking. Try with fish, having white fish once to twice a week, and having oily fish 2 times a week is helpful. And even try having meat-free days where you're having an increase in plant-based proteins is certainly good and great for your fiber intake. aiming for at least 5 to 7 portions of fruits and vegetables per day, and try and eat the rainbow over the course of a week. So have a range in your colors. Using lower fat dairy options is helpful, and trying to have, 2 portions of dairy a day is good. So things like low fat milk, cottage cheese, low fat yogurts. Try and have kind of natural yogurts that you can flavor with maybe adding fruit to it rather than using the sugar sweetened versions, or having the low calorie, high protein options are good as well. They generally tend to be a bit lower in terms of the sugar content. Choosing whole grain carbohydrates is really good. The fiber will help you feel fuller for longer, and has many other kind of health benefits. If you are hungry after a meal, I would say give yourself about 10 minutes once you've finished your first portion to see if you are truly hungry. Our tummy takes quite a while. There are stretch receptors in the stomach, and they stretch when we eat. But that message to get from the stomach to the brain can take about kind of 10 to 15 minutes. So actually giving a little bit of time um, between any seconds is helpful. Also, when it comes to these sort of things, thinking about, if you are having snacks, stopping and kind of thinking about, kind of rating your hunger before you have a snack. 0 being not hungry, 10 being starving. Often snacks are kind of more down to habit, or can be kind of boredom, or times of the day and things like that. So that's also something just to consider, or whether you're thirsty over hungry. So they're just little things to think about. So based on what we've looked at today, if we think about meals you'll have during the week, let's look at meal planning. So if we start with breakfast, based on your lifestyle goals, it might be to, excuse me, you might wish to include more fibers or fruits and vegetables. You could try things like Bircher muesli, porridge with fruit on top, overnight oats, yogurt with cereal and fruit. You might want to have something like, scrambled eggs with spinach, or an omelette with spinach and mushrooms. So good places to look for recipes are the BBC Good Food website, I think is great, or BBC Food have really good recipes. BBC Good Food is quite good because you can kind of set the parameters like lower calorie or healthy eating. And the booklets that I've put in the resources are also really good links. So the Breakthrough Cancer Research booklet that I mentioned earlier has delicious, healthy recipes. And I've also added some cookbooks from the World Cancer Research Fund in the resource list, which are full of healthy recipe ideas as well. If we think about lunch, then you might think about having salads with carbohydrates like quinoa, potato, sweet potato, millet, barley, and having loads of veg then, mixed into it. Having plant-based protein, fish or lean meats as a kind of side to balance the meal as well. You can make kind of one large salad. This might last over 2 to 3 days, and you can, provide variability then by adding different types of proteins and different types of dressings. Things like a frittata that's packed with vegetables is a great low calorie, high protein option. So it's really filling, and it's really rich in terms of nutrients. And then moving on to evening meals. So when you think about evening meals as well, you can reuse these in the next day for lunch. So when you are doing your meal plan, you can kind of reuse things, so you're saving on time throughout the week. Based on your meal plan, make a list for your food shopping and stick to it when you go to the shops. You can even divide it into things like your fruit and veg section, fridge section, and frozen section. And when you get to the checkout, then review what you have in your trolley and be proud of it. So we want your trolley to really reflect the basis of your healthy diet and your lifestyle goals. We know that 90% of the work is done by the time you come home from the supermarket. So when you kind of, set your meals, when you plan your list, and when you avoid bringing lots of different snacks that you don't want to have in the house, it can be really helpful during the week when it comes to eating, if you kind of know what you're having and you avoid having certain things in the house that you might not want there. I like the idea of a power hour on a Sunday to prepare meals. So You can make things a few days in advance. So it might be doing things like yogurt pots in old jam jars, or Bircher muesli in jam jars, overnight oats. You can roast some vegetables that you can use to make sandwiches or salads. You can prepare some evening meals and freeze them or chill them. I find that quite a useful way to kind of plan ahead for the week. We know nutrition is just really one part of the package. So physical activity has many positive health benefits, both health benefits and mental health benefits independent of diet. So we know 30 minutes of moderate intensity exercise improves things like your blood glucose levels for up to 2 days after you exercise. Try to build up to a minimum of 150 minutes of moderate intensity exercise per week. That is kind of the national guidelines. At the moment, research suggests that only kind of 40% of women and 50% of men meet this goal of 150 minutes per week. Another thing to aim for would be aiming for 10,000 steps per day. You can record this on a Fitbit or your smart device or your phone. Managing stress is really important. So taking time for self-care. And if you need to get support, look for support through your cancer centres or the Irish Cancer Society. There's always somebody there to listen within the cancer support centres or within the Irish Cancer Society nursing support line, or the Daffodil centres as well. So as we discussed, aim for moderate amounts of alcohol, or it might be something you choose to avoid. Try and get enough sleep. Having good sleep can play a really huge role in terms of your food choices, in terms of weight control and mood. Limit things like smoking, and make sure you are keeping well hydrated. So even 2% dehydration can impact in terms of a person's concentration levels and kind of brain fog, which is something that we often hear reported during and after treatment. So all of these factors are important, and kind of diet is just one piece of the puzzle. From evidence, we know the majority of cancer treatment, I have said this before, a lot of people they lower their physical activity levels before, around the time of diagnosis, and many people don't kind of return to their pre-diagnosis levels of activity. There can be a whole host of reasons for this. You might have ongoing side effects. Deconditioning like muscle loss or reduced strength or breathlessness with exercise can, put people off. People also report kind of changing their habits and their routines. And there can be fear of restarting exercise and maybe not knowing where to start. Speak to your medical team always if you have any concerns with returning to exercise. And we also know exercise is really important, as I mentioned, for maintaining muscle mass and muscle strength and reducing the risk of frailty as we get older. But it's also important for reducing the risk of things like heart disease and diabetes when we look at longer term health. It is really important actually in reducing the risk of recurrence. So research has shown that women with breast cancer who meet the recommended 150 minutes of moderate intensity exercise had a reduced overall risk of breast cancer recurrence by 40% compared to women who are less active, less than 60 minutes per week. With colorectal cancer, the evidence suggests that the risk of cancer recurrence is reduced by 50% when performing, 6 hours of moderate intensity exercise. So that'd be kind of an hour a day, 6 days a week, which is a good bit more than the, recommended guidelines. But this can be things like brisk walking, dancing, cycling, jogging, aerobics. Within prostate cancer studies, the studies indicate that there's a lower risk of prostate specific mortality by 30%, and a lower risk of disease progression or cancer progression of prostate cancer by 60% with 3 hours of moderate intensity exercise a week. So exercise works hand in hand with dietary changes, but as I said, it has a really independent role in terms of things like mood and the cardiometabolic profile of things like blood sugar levels, cholesterol and triglyceride levels as well. If you did want to look for support, I think these are two really helpful websites in Ireland. So Exwell Medical provides structured exercise classes for people during and after cancer treatment. There's many sites that you can attend in Ireland. A lot of them are concentrated around Dublin. but you can do them on Zoom as well. And there are phone-based classes that you can do. So they have a 12-week program for people returning to exercise after cancer treatment. It's called the Move On program. And you complete an assessment with the team at the start and at the end. You do need to be referred by a doctor to the program. So, but the referral forms are all on their website. And, you know, if you did want to, you can even just call to talk to them about what is on offer. The Perks website is a relatively new website that's been designed by physiotherapists and exercise specialists in St. James's Hospital. The website aims to support people to become more active during and after cancer treatment. And there's several different sections within it. There's exercise programs, so there's videos there that you can use from exercise specialists. There's a service directory, which I think is quite clever. So it's a national directory of exercise and rehabilitation services suitable for people with and after cancer treatment. And then there's articles. So there's just information on physical activity, cancer rehabilitation, and those types of topics. So if you want to, you know, read more, it's a really helpful website to go to. But thank you all for listening today. I was longer than I had expected, but I'm really grateful for you guys to take the time. If anyone has any questions.